Hey there, this is Dr. Evan Osar with Integrative Movement Insider. Welcome to this edition of Integrative Movement Insider. Thank you so much for being part of our community and allowing us to be part of your community. I just want to share a recent conversation I was having with a colleague just last night. My friend was asking me, my friend Jackie Bachmeyer, who owns, along with her husband, Jason Eichen, they own Evolution Fitness and Wellness. And they specialize in working with older adults. So people my age, 55 and older. So recently she had a conversation. A client came to her. She trained small group training, and a client in front of the class asked her, "Hey, I just came from my physical therapist. My physical therapist said we shouldn't be rotating. And now you're telling us and you're teaching us to rotate. I'm so confused." And then the whole class stopped, and it was kind of like, that with the record. And she was like, "Oh," I was sort of caught off guard. And so, what do we do when we hear things like that from physical therapists, chiropractors, medical doctors, or other healthcare professionals? Number one, first, we want to be respectful of the individuals. Hey, Rahul, over in India, how are you, my friend? Good to see you. We want to be respectful of these medical professionals and never badmouth them, never say, oh, they're wrong or they're right or whatever. Just respect what they say and gather more information, because many times your clients are hearing things and maybe they're not hearing things accurately. Number two, work within your scope of practice. We want to make sure that we respect the other professions. Remember, there's a relative hierarchy. Even though you as a fitness professional see your clients way more, you know way more, you understand your clients way more than a health professional like myself, who may just see a client once a week or once a month or once every quarter. You know your clients. So, however, you still want to be respectful of that individual and work within your scope of practice. Number three, you have to be the educator for your client. Ultimately, you need to educate your client. So, my friend, she offered the client and the whole entire class, because a lot of these other clients were in the same position. They're like, yeah, I hear things from a medical doctor or my medical professional, and it's contradictory to what you're teaching us. So let's talk about spinal rotation real quickly, and I'll give you my suggestion. And this is really what Jackie said. So I'm just repeating what she said. When we think about the spine, so we have seven cervical vertebrae, we have 12 thoracic vertebrae, we have five lumbar vertebrae. So essentially 24 segments that have the potential to rotate. Now we know that certain areas of the spine, C1, C2, for example, that has 50% of our cervical rotation happens at C1, C2. It's designed for rotation. Our cervical spine has 90 degrees overall of cervical rotation. So we need to be able to rotate the cervical spine. So a lot of our rotation will come from the head and neck, or C1 through C7-ish. Our thoracic spine, our facet joints, so the joints that are in the back of the spine, they're designed like this. The facet joints guide motion. So they're designed to rotate. So the majority of our spinal motion below the head and neck should come primarily from the thoracic spine. Hello, Cynthia Allen. Good to see you on this morning as well. Speaking for your conference here just in a few weeks, probably, yeah, five weeks from now. So excited about that as well. So check out Cynthia's conference. Cynthia, if you want to put the link in here, you can throw that in there as well. Move Better, Feel Better conference. So looking forward to that, where we're talking about spinal rotation, actually. So, and then if you go back to the lumbar spine, five segments there. Now, those facet joints, so the joints, the portion of the vertebrae that guide motion, the facet joints in the lumbar spine are more sagittal plane. So we have much more flexion extension, but we have some degrees of rotation. And that's why spinal fusion is so troubling. Not troubling, it's troubling, yes. However, it can be so detrimental to optimal movement when clients have their spine fused. And I'm not saying many of them need their spine fused, some of them. However, we once we lose motion at a specific segment, we will make up for it somewhere else. So even though we have lesser degrees of rotation in the lumbar spine, we need that rotation. If we lose rotation at any segment, then we will make up for it somewhere else. Could be a segment above, maybe a segment below, maybe several regions above and or below. So having said that, 24 vertebrae, all of them have the potential and need to rotate. And the easiest way to think about this is look at a golfer. The real good golfers would never just lock a portion of their spine and then try to rotate. If you watch, they create awesome rotation because they have the ability to rotate through the entire spine. Okay, out of that way. Now, think about our older clients. Now, many of our older clients, let me back up one moment. So we need, in order to access rotation at every level, obviously we need the right level of, number one, alignment. That's why we talk so much about alignment. We want to have a long spine. What helps us keep a long spine is then motor control, the motor control of the muscles around the spinal column. So we'll just say all the trunk and spine muscles. There's more muscles than that. Also, the shoulder muscles and the hip muscles also contribute to that as well. However, let's just keep it at the spine. So we need the optimal alignment and we need the optimal motor control. We also need the ability to control internal pressure. So pressure inside the thoracic cage, pressure inside the pelvic or abdominal cavity. So pressure regulation comes from optimal breathing. That's why our principles of the integrative movement system, ABC, alignment, breathing, and control, is how we teach our clients to rotate and how we teach our clients to move generally more efficiently, more optimally. Okay. Here's a quick, easy way to explain it. And this is exactly what Jackie did with her clients. She took a stability ball. So this is a great way to explain, again, simplified, but you got to make it simple for your clients. Think about your thoracolpelvic cylinder. So thoracolpelvic cylinder being the rib cage over top of the pelvis. Think of that as represented by the stability ball. If the stability ball is blown up to its proper, appropriate capacity, then when you push down, when you compress this ball, it doesn't decompress, right? It maintains its relative position, right? Because again, the internal pressure pushing out against the material of the ball helps to maintain that stability. So I could sit on here, I could lie on here, I could put some load on here. As long as I don't overload it to the capacity of this ball, it will stay stable and not decompress, relatively speaking. Well, our thoracolpelvic cylinder is the same way. When we have the right surroundings, so the right muscular component, the motor control aspect of it, and we create the most optimal pressure regulation through optimal three-dimensional breathing, using the diaphragm appropriately, using all the muscles of the thoracic cage, because they're all part of the respiratory system. We're using our pelvic floor appropriately, we're using that transverse abdominis appropriately, then we regulate optimal internal pressure regulation. So that allows us to maintain spinal length, that allows us to create that rotation. It frees up some of these muscles that are oftentimes overused in the role of stability, just stability for everyday life, frees them up. So now you can just focus on creating rotation. So now you have better ability to access your rotation. Now what happens? Let's fast forward several decades. What happens to many of our older adults? So people that, again, it happens to us younger ages, but let's just fast forward to 50, 60, 70. Well, now our clients are much more compressed. Okay. So now we don't have that same optimal pressure regulation. And that's why you see so many of your older clients belly breathing. That's why so many of your older clients have that distended abdomen, because they've preferentially started to use less of the thoracolpelvic cylinder and gone to where it's easier to breathe because they've compressed their thorax down on top of their pelvis. So now they become belly breathers. So now they start to overstretch the abdominal fascia and the abdominal wall. It's not just because they have visceral fat, which some of them do, but it's really about they're starting to change how they're breathing. They're starting to overuse abdominal breathing, lower abdominal breathing, and not using the rest of the cylinder. So they get compressed and they start using abdominal breathing, and or they also will start to use a more sagittal plane breathing strategy. So still suboptimal strategy, both of those being suboptimal strategies. Well, now when our client tries to rotate, there's not the ability to lengthen to get rotation. Now they're compressed, not breathing well, not controlling internal pressure regulation. They're overusing now a lot of thoracolpelvic cylinder muscles for stability, and now they start preferentially rotating through smaller and smaller segments of their spine. And this is directly why I believe so many of our clients, our older clients, have spondylolisthesis or retrolisthesis. So listhesis means a fracture of the vertebrae, where they're starting to move the vertebrae too much, because I believe that when you lose the capacity to lengthen and have more of the spine to contribute, you're going to over rotate through your neck, where there's still a little bit of motion left, and the low back, where there's still, where we're not supposed to be getting tons of motion from. And that's why so many of our clients have these conditions like spondylolisthesis. The vertebrae is moving too much, or retrolisthesis is moving too far forward and or too far posteriorly. So this is why it's so important that we know our clients' medical history and that we understand what we're doing with our clients. So one of the things, regardless of where our clients are starting or where they're coming to us with, our first priority is to get our clients breathing better. We have to get our clients breathing better, using more of the thoracolpelvic cylinder, because breathing not only obviously helps keep us alive, it optimizes obviously pressure regulation and stabilization. And it really is what helps us decompress our spine. If you're not breathing through your nose, if our clients are not breathing through their nose, they're not breathing through their entire cylinder, they're not decompressing their spine. So they will continue to compress, they'll continue to lose thoracic and or spinal rotation overall. Now, let's go back to the statement that we started with. Should our older clients rotate? So yes, our clients should rotate. Now, some of our clients, we may need to teach them how to be more stable here and just rotate through their pelvis to begin with, because they may not be able to get long enough and or control their rotation enough to rotate through their spine as of yet. However, think about everyday life. We have to be able to rotate for everyday life. And one of the most important things we do in everyday life is walking. We have to be able to get spinal rotation for walking. And if we don't, we will compensate somehow. And that's why some of our clients rotate, I should say not rotate, they essentially side bend, they laterally flex through the frontal plane because they don't have the ability to rotate. So now they're making up for it in some other plane. And that frontal plane is the next easiest position to, or plane of motion to make up for that loss of spinal rotation. That increases the risk of falling, that overloads the spine, that overloads, it causes it's a huge cause of that valgus knee position. So again, when we lose spinal rotation, we're going to compensate, we're going to make up for it or have to make up for it somewhere else. So what Jackie explained to her clientele was, number one, we need to rotate. We need to learn how to rotate appropriately by first lengthening, aligning, second, breathing, and then finding an area, hopefully through the thorax, where we can start to create just small amounts of rotation and really teaching our clients how to control that. And she said it was so cool. Like it was like light bulbs going out off in front of all the clients. They're like, oh, now we understand what you're talking about. So find simple ways to explain what you're doing with your clients and why alignment, breathing, and control relate to the things that you're teaching them to do from a movement perspective. And then the light bulbs, sooner or later, the light bulbs go out. Sometimes sooner, hopefully, if not sooner, then later, your clients start to see, oh, that makes so much more sense of why we're doing or why you're having me do this exercise or why we're working on this breathing. Because, they can't always relate why they're working on breathing to help them walk better, to help them balance better. And there's lots of research, I'm putting in my new book, lots of research around how breathing helps walking and motor control, and obviously the parasympathetic nervous system and digestion. And you name it, it probably improves it. Fascial, integrity, the mobility of the fascial system, especially the internal fascial system, improves the function of the pelvic floor, improves pressure regulation.